Hello, I am sorry that your DNA test brought up your likelihood of developing type 2 diabetes. I'm just going to talk to you a little bit about that and not to panic because there are things that we can do for that. And so when a genetic risk comes up from someone's DNA test and shows there is a risk to something like type 2 diabetes, it is essential to understand that this is not a diagnosis. This only means that there are increased risks for you, and since your genetic testing indicates that you do have an elevated risk, it means that you have specific genetic variants that can increase the likelihood of you developing it. Does not guarantee the development of type 2 diabetes. So environmental and lifestyle factors often have a significant impact on your health, and so some results indicate your risk relative to the general population, which can translate to an absolute chance of developing it. But this only depends on factors such as age, family history, weight, activity level, and other specific characteristics. So since we now know that you are at a higher risk, it is essential to confirm and understand your result by consulting your doctor. And questions to ask would be which genes were actually used. There's monogenic and polygenic risk scores. How does this risk compare to the general population for your age and sex? And are there risk factors or other risk factors in your family history that can be considered? So I would suggest focusing on modifiable risk factors, which these are the lifestyle habits that can be controlled. Lifestyle can have a significant impact on delaying or completely preventing type 2 diabetes with weight management and regular physical activity. Even a modest weight loss, 5 to 7%, can substantially reduce your risk, along with regular physical activity for at least 150 minutes a week, and then you can add in some strength training. Healthy eating is also essential, emphasizing vegetables, fruits, whole grains, lean proteins, and healthy fats, while limiting processed foods and added sugars. So super important. Sleep and stress management are also essential. So if you were to prioritize 7 to 9 hours of sleep, as well as developing healthy coping mechanisms to manage your stress, is ideal. Also, avoiding tobacco and limiting alcohol will help reduce your risks for developing type 2 diabetes. So your doctor may also want to screen you for something that's called pre-diabetes, which is the precursor to developing type 2 diabetes. Pre-diabetes also puts people at risk of other serious conditions such as a heart attack, stroke, and research shows that a diagnosis of pre-diabetes can actually inspire individuals to embrace lifestyle changes such as eating healthier, managing weight, and becoming really active. These can all prevent and delay the onset of type 2. I would also recommend regular blood glucose screening. Depending on your risk, it may be recommended to get a fasting plasma glucose, an A1C test, or an oral glucose tolerance test at intervals of 1 to 3 years. Additionally, metabolic health checks would also be beneficial, including the monitoring of your blood pressure, cholesterol levels, and waist circumference. So since there's such a strong family history, your doctor may tailor your screenings and prevention strategies to be implemented at an earlier stage of life, at least earlier than when most people would do these. So please don't panic or assume that you will definitely develop type 2 diabetes. Don't rely solely on genetic risk to guide your medical decisions, but consider the whole risk profile. Some questions you can ask your doctor would be, how much does my genetic risks contribute to my current lifestyle factors? Should I start more frequent glucose monitoring or early prevention programs? Are there any personal strategies based on my specific gene variants that I can do to protect myself? And since this is not a diagnosis and you are already eating a healthy diet, there are things you can do now to reduce your risk before actually developing full-blown type 2 diabetes. So I hope this makes you feel better, and good luck to you.